This is QD Clinic. Hi, I'm Jack Cush with Room Now. QD Clinic is brought to you by Room Now Live, March 19th and 20th coming up. You know who goes to Room Now Live? People who love rheumatology and want to learn. Second, rheumatologists who don't want to miss out on the important stuff, the FOMOs, fear of missing out. It's a big driver in some people. And then the handicaps. They're not coming. Who's Andy Capp? Andy Capp's a cartoon character. My favorite line from Andy Capp, the cartoon, is Andy's asked, he's kind of like a crotchety old Londoner pub guy. And at the pub, he gets asked, Andy, what do you think of ignorance and apathy? And Andy says, I don't know and I don't care. Meaning, Andy Capp's not coming to our meeting because he doesn't know, he don't care. That's not you. We'll see you at Room Now Live. Today's case is shared decision making, or what do you do when the patient doesn't want to take the medicine? So this is a 36-year-old man who I've been taking care of for a few years. He has psoriasis since about 9 years, psoriatic arthritis for the last 3 years. He's been treated with nonsteroidals and a brief foray with methotrexate, done well for almost 3 years on adalimumab. He comes in today because he's not doing quite as well as he used to do. He has no other significant past medical history, really doesn't take any other medicines. And today he comes in because he's not doing well, and turns out that he's not doing well maybe because he stopped his medicine 6 weeks ago. Why did he stop his medicine 6 weeks ago? Well, insurance issues, money, pharmacy, whatever. But the bottom line is he's probably not wanting to take the medicine, and when you ask further, you find out he has been spacing out his injections and not taking the adalimumab as he probably should take. So what are his medicines that he takes? He really just takes probiotic, adalimumab, and he has some cream that he doesn't use generally. He's big into diet. He thinks that an anti-inflammatory, low-gluten diet has really helped him quite a bit. And he thought that that was going to sustain him if he went off of his adalimumab or took less adalimumab. So not surprisingly, taking less adalimumab, he's taking a little bit more over-the-counter ibuprofen, using more topical steroids. He's not doing well. On exam, when you examine him, his skin is active. He has psoriatic plaques in his scalp behind his ear and also at the crack of his butt. Nothing in the umbilicus or nails or elbows or other usual spots, meaning you'd have to look to find it. Second, his joint exam is not great, but not too bad. He has 3 tender joints, no swollen joints, no enthesitis. So the question is, what are you going to do? The rest of his exam is normal. His labs recently done were normal. He doesn't have inflammatory markers that you would be concerned about. But he's got some active disease and he's got some more joint complaints. If you look at his joint scores, I do a GAS score. It's like a CDI score. The numbers over the last, eight numbers times, that's basically 4 years, are like 6, 3, 3, 2, 4, 2. The last, 6 of them. Meaning that he's got low-grade activity, but then he admits to not necessarily taking all his medicine all the time. He's one of those folks who thinks, doc said I could space it out a little bit. Let me see how little I can take. I think he's one of these folks who probably wants to believe my disease isn't real, and if I hope hard enough, it might go away. Well, unfortunately, it's not that easy. And also that maybe the dietary help he's getting isn't helping quite enough. So he needs to restart something. He knows it. His skin, his scalp, are saying that. His joints are saying that. And what are his options? Number one, let's stop the biologic and go back to the nonsteroidals and see. Do you remember what that was like 3 years ago? He says, I don't want to go there. Number two was an option. Let's restart the medicine that was working well for us. Took us from 6 down to 0. 630, I think, was the numbers that he had on joint scores. And no skin involvement. let's go back to that. But it requires you to be compliant with the medicine. Starting out every week just to get started, and then we'll go to every other week. And then you can't space it out as you wish to or want to. Or go to option number 3. Give him a drug that maybe he doesn't have to take so often. You know, some of the newer IL-17 or IL-23 inhibitors you can get around to taking once a month. Or once every 2 weeks, depending on what he needs. So give him that option and see what he thinks. What do you think the guy chose? Did he go back to the one that he's familiar with, or did he go with the new one with the promise of maybe taking less drug? That's right. He went back to the one he's familiar with. Dance with the one that brung you, meaning people are adverse to change. Interestingly, didn't plan this, but we have a nice session on that on the first day at Room Now Live. Caleb Michaud from University of Nebraska, Omaha, is going to talk about drug adherence and unwillingness to change therapies by patients. He studied that inside of the Forward data registry. So we wished him well. We put him back on drugs. He did fine. He got better control of both his skin and his joints, and we'll see what he does going forward. The good news is he has options. The good news is he had choices here, and giving him the choice and discussing with him the consequences of his choices were, I think, important in motivating him to possibly be a better patient. We'll see what happens. Tune in tomorrow for more QD Clinics.